what are we doing to our children? Filling their cell membranes, filling their mitochondria with seed oils. Our bodies can't get rid of these easily. This could definitely set these kids up for obesity, for becoming fat as kids, for developing...
So I actually hate this video because it has an element of truth to it, but then it's a very exaggerated claim without any context or nuance behind it. The vast majority of parents know that breastfeeding is better, they want to breastfeed their kids, and they usually have to formula feed as a supplement because either they're not producing enough breast milk, they don't have access to it, they didn't produce any in the first term, and lifestyle issues. So let's see if there's an element of truth to formula feeding causing weight gain and what we can do to mitigate it if that's the case, and if there's anything to worry about. Okay, so first off, that breastfeeding is highly recommended, especially exclusively for the first 6 months of life. The World Health Organization, the American Academy of Pediatrics both agree on that, so no doctor is promoting formula feeding over breastfeeding. And studies do confirm that formula feeding has increased weight gain versus breastfeeding, but it might be due to the bottle and not just all the different ingredients that he was talking about. So what I mean by that is that the rate of feeding is slower when the child is eating through the breast. When you do the bottle, a little bit of that health benefit is mitigated, and then formula than the other two. It is clear that for the first 2 years of life that breastfed infants are less likely to be overweight, and children that are less overweight in the first 2 years of life are less likely to have obesity risk in the long term. And formula feeding is associated with a more rapid weight gain. So the question is, why does this occur? Because it is an association. So one of the possibilities is that the actual bottle and how big the bottle is might change the dynamics in how the child eats in the first place. Meaning that the parents might be accidentally overfeeding the child because the bottle might be having a higher flow rate, there might be more volume there, and things that are confused for reflux might actually be overfeeding. In studies where they actually made the bottles smaller, and nursery bottles now are smaller based on studies like this, the children did eat less. So here in the blue, this was before the intervention when they were using bigger bottles, and when they switched to smaller bottles, the food volume also decreased. Another possible element is the microbiome. Human breast milk has HMOs, which are human milk oligosaccharides, which supply the gut bacteria of the infant and kind of sets them up for life. So as a father who had to formula feed both my babies, general recommendations are, if you are formula feeding, try to introduce solid foods around 6 months of age and make those healthy foods. A little bit of breast milk is better than no breast milk, even if you have to supplement with formula, and consider smaller bottle sizes if you're formula feeding. I hope that helps.